Hi there, my name is Dr. Natalie Archer. I'm a dentist practicing here in Toronto, Ontario, and I've created a video, which is a series of videos for people who are taking care of other people taking care of other people's teeth, and their oral health care, which, as we know as a profession, that the mouth is the primary portal of one's body. In fact, an alarming statistic is that the #1 cause of death in long-term care facilities is acquired pneumonia. Did you know more than 4 million people in Canada need the help or care of someone else to take care of their teeth? It's an alarming statistic. And what's interesting through the culture, the observations, and my hands-on experience that I've seen is that a number of people taking care of other people, such as personal support workers, nurses, family members, caregivers, don't have the education, the tools, the training, and such the confidence to actually take care of one another's teeth properly or with best practices. One of the things that I have learned within the last probably year or so is my appreciation for the nursing profession. They are our hands-on frontline workers every day, and I cannot express how much I commend their efforts. One of the things that we do on an annual basis is at Runnymede Dental Centre is we do a teaching hands-on module for Nursing Week. And one of the questions that I usually ask the nurses is during their curriculum or program, how much oral hygiene training they received. And the hands are sparse and few, and I've done some investigation and research to find out that for the most part, from what I can see, is that there's usually a 1-day or half-a-day program in terms of the oral hygiene instruction. Those young nurses are now into nursing homes, retirement homes, complex care hospitals, and the typical patient that they see on an average day is not like themselves. And so you can imagine what happens is you create a culture of unknown. You create a culture of uncertainty. And so part of the purpose in our videos today is to actually bring some patients from our current hospital that are more duplicative of what your average patient is. Here in my dental clinic, I have all kinds of fancy lights, tools, water, and assistant to do my job with ease for the most part. But the nursing profession, you're up there, you've got very little time, you have to find the tools around you, and you have to be able to do that job in a very quick, comfortable manner. I'm thrilled to bring you some series of videos, some tips, some tricks, just to make it easy, to give you that confidence, and so that we can really increase our oral hygiene awareness, our education levels, and really change the culture here in Ontario. Enjoy. I'd like to speak briefly about a video for dentures, or removable prostheses, teeth that come outside of the mouth. So very high level. It is very important for the dentures to come out at night, whether they're a partial denture or a complete upper or lower denture. It's extremely important for the tissues to rest at night. It's extremely important for the dentures when they're outside of the mouth to be kept in a very safe place so that they're not susceptible to falling on the floor or breaking. Also in a solution that is either water or something very clean. Absolutely, under no circumstances should you put them into bleach, hydrogen peroxide, in the microwave, in the dishwasher, or anything else. I know you're laughing at this point, but this is a common conversation I have every month with people, and so I'd like to get it out there on what is best practices. We'll be showing you how to take dentures in and out, and obviously any patient who has dentures should be seen regularly, at least annually, by a dentist for an oral care cancer inspection, making sure there's no soreness, pain, lesions, etc. in the mouth. And I look forward to empowering you how to take care of someone's dentures. So I want to thank Bogolup for participating in this video. One of the nice things is, or challenges that sometimes we see is Bogolup speaks Croatian.
Croatian, yes.
I speak English. You don't speak much English?
Yeah, English, not too much.
Not too much, and I don't speak any Croatian. So this is one of the things sometimes we see is language barriers. But it's very important that we're able to take care of Bogolup's teeth. Bogolup has removable dentures, and I'm just going to get you to open.
Yeah.
Bogolup has a partial denture, and I can tell because he has a little metal clasp that I'm going to use my finger ever so lightly just to lift and just very safely remove and have my hand over top so that we don't want to drop the denture. And I'm just going to put that on my tray. And with the top, again, and close a little, and I just sort of close a little bit just to get the suction or seal, just to get it off like so. Again, I'm always taking it out and holding it with my hand underneath to make sure that we don't drop it. You can relax.
Okay.
Good. Another trick you can do is ask a patient to blow their cheeks up like so, and it breaks the seal as well. I love how this denture is labeled with his name on it, and especially in hospitals or in long-term care facilities when patients frequently move in various different rooms, floors, etc., things and belongings can get missed or misplaced, and I'm sure it's very difficult for people to ascertain whose removable prostheses are whose when there's a room of people with the same sort of situation. If we were to finish cleaning the dentures, I've just gone to the sink just with water and a denture brush, and I really scrub it actually. I really scrub the teeth surfaces on the outside around where the clasp is, and then if you flip a denture over, there's always plaque and bacteria all the way inside on the inside of it. So when we're putting it back into somebody's mouth, it's nice and clean. Now the trick is, if you're using gloves like I did, you can see how wet my gloves are, and they're very slippery. So you just want to make sure that, again, I'm using my hand, making sure I don't want to drop Bogolup's denture, or he would not be very happy with me. In terms of taking dentures out at night, we want to make sure that we're putting them in a very clean, changing solution. I just happen to have a sample of Polydent that our patients use. We give them samples to keep the dentures in the basin. If you don't have it, not to worry about it. You can just simply put straight up water. And putting the dentures back in, again, I would take the lower and just very gently pull the cheek a little bit apart, put it back in, rest it using my fingers underneath, making sure, and it's comfortable. The same thing with the top. Again, I pull the cheek out a little bit just to get the space, put it back in, make sure my fingers are out of the way, and we're back where we started from. Thank you so much. Thank you so much.
You're nice.
Thank you.
Okay.
I'd like to speak just very briefly, high level, about toothbrushing, the importance, and probably trying to come up with some best practice advice. Toothbrushing should be done twice a day, ideally in the morning, after breakfast, before you go to work or school, or before one starts their day. And the most important time from a dental perspective is definitely before bed. Why? Because our salivary flow rate is our lowest at the night. So you can imagine, without a lot of saliva flowing through the mouth, everything sticks to the teeth. So brushing our teeth before bed is extremely important. Having a toothbrush that is changed regularly, ideally every 3 to 4 months, where the bristles are intact, soft, and kept in a clean place is important. And using the smallest amount of toothpaste imaginable, a pea or smaller is ideal. If the patient has swallowing impairments or difficulties with digestive, even no fluoride toothpaste or no toothpaste at all should be used, so for the swallowing purposes. So I'd like to introduce Barbara, And I want to thank Barbara for helping us participate in an oral hygiene instruction. Barbara has an interesting condition where she can't have a lot of fluids, correct?
Yes, right.
Correct. So can't drink waters or different things like that. So couple things for somebody like Barbara. If I was a nurse, personal support worker, caregiver, family member, one of the first things that's very important is to make sure you have all of your tools and props ready to go.
Right.
So I would have Barbara sitting up as she is. I would let her know that we're about to brush her teeth. We do the circular motion just to show that that's what we're going to be doing. Thank you. And then having the obvious things ready. The toothbrush, a little bit of toothpaste if we were using toothpaste with Barbara, 2 cups, one with a little bit of water and one just on the side that's empty just in case she needs to expectorate or spit at any time. 2 of the things that I always suggest for people to make it comfortable for themselves is to have safety glasses so they feel comfortable, so something along that line, just like you're wearing your safety glasses. And a mask if they also feel, just to protect them as well and to make sure we're not coughing in Barbara's mouth. For the purposes of this video, I won't use those tools, but because Barbara can't have any fluids, we would be using our specialized toothbrush or a regular toothbrush if that's what you have, and we would be dipping them in water. So I'm going to start with my favorite toothbrush, which is the Surround toothbrush. It actually matches your outfit quite lovely. And I would just dip it in the water to make sure that we have it nicely there. I would be putting on my gloves. If Barbara had just had a meal or there was excessive food, etc. in the mouth, having some gauze or some tissue available. And I would take the toothbrush, wonderful, she already knows. And I always love starting on the opposite side of where I am in terms of brushing the teeth there. You can take your time, not to rush things, and also make sure that you're letting the patient know what we're doing, etc. And we want to make sure as well that we protect her outfit. So I sometimes have paper towel as well ready in case she needs to spit or wipe anything off.
Thank you.
You're welcome. Thank you. And that kind of thing. And open again for me. And same thing with the top. We're using our specialized toothbrush. Just open for me, Barbara. Perfect. And it's really easy. I mean, patients love their teeth being brushed. It's clean and fresh. And I want to empower people, family members visiting, etc., nurses, caregivers, etc., anybody can easily be able to clean one another's mouth. I want to thank you, Barbara.
Thank you.
The following video is a specialized video. Specialized in the sense that I want to talk about certain types of patients that present unique medically compromised situations, whether they have a G-tube, whether they present with mental issues, dexterity issues, whatever the medical issues are that allow these patients to get more buildup, more plaque, more calculus. And also what's challenging is being able to get into their mouths is also challenging. And these are especially the types of patients that I want to empower you, the people who are taking care of one another's teeth, to give you some tips and tricks and tools to make it easier. 2 of the specialized products we use within our dental clinic do just that. One is a specialized mouth prop and one is a specialized toothbrush. By using one or both of those products, make it really easy, effective, and safe for you and the patient to do what you need to do in terms of increasing their oral hygiene. So today we're at the Runnymede Dental Center with Bill. Bill and I Bill and I have been together for 2 years. And today's purpose, just a very short synopsis. If I was a nurse, if I was a personal support worker, if I was a family member or caregiver, what are some of the tips and tricks we would do up on the floor to care for your Bill's teeth? I love to use gloves. These ones are bubblegum flavored in the dental clinic. If they're not so good tasting, you can always ask people just to rinse or wash the gloves. Just takes the vinyl or the latex flavor away. They can also wear safety glasses. I won't be for the video, but something along that line.
So there's safety glasses.
You wear safety glasses as well. Normally in the dental office, I would be wearing a mask, but for the purposes of this video, you may not be able to hear me as well, and so I won't. So Bill has in your hand, if I may, wonderful, our friend, the handy dandy toothbrush, which most patients would have. And normally with any patient we normally do, Bill is right on his game, but we usually tend to just rub the cheek in a very circular fashion just to signal that we're about to do toothbrushing or cleaning one another's teeth. We do that in the dental center, we do that at Runnymede for all our patients. We try and teach our nurses to do that. We try and teach all the caregivers and family members that in all of our literature so that we're all consistently doing the same kind of symbol. That's right. I personally would get Bill to open, perfect, and with a regular toothbrush, I would be brushing the grinding surfaces. I would be going on the outside surfaces, and Bill's just such a treat, and on the inside surfaces. So, I mean, Bill is just fantastic to do that. I usually have all my tools ready, so if he needed to spit or expectorate, we have a cup there. Also, I like to have half a cup of water just ready in case he wants to rinse before, if it's just been lunchtime, anything along that line. In terms of toothpaste that we use, Bill has a G-tube, so swallowing is an issue. Yeah. So, right. So usually for patients like Bill, we will not recommend fluoride toothpaste or toothpaste in general. But if we were to use just a tiny little bit, we would be just using, you can kind of see, not even a pea size, but it's just extremely, extremely small. You can hardly see it.
I use more than that.
Yeah, you shouldn't.
Okay.
So we would put that on. And again, in terms of opening the mouth like so, I would just put my finger like so, just to get in on the top surfaces, brushing surfaces, etc. Now, Bill has been a patient at our clinic for 2 years, and so he's been privy to some pretty handy dandy tricks we have to make it really easy. So for example, if Bill was not feeling so great, having a difficult day, I love these mouth props. They are a patented mouth prop called the Open Wide Grip, and they're spongy, they're antibacterial, and let's see here, bite together for me, Bill. Good. And this is a way, some nurses are afraid of the patient biting them or closing down on them inadvertently, so it allows me to brush the surfaces this way. Take it one step further, and I would use this very specialized toothbrush called the Surround toothbrush, because the bristles are on a 45-degree angle and allow me with one simple movement to brush just the grinding surfaces, but imagine it gets the outside surface of the teeth and the inside surface of the teeth just by the fancy-dancy creation of the bristles there. If we're not having my specialized tools here, we provide a website in which the institution, family, anybody can purchase or get those. We also offer them here at our dental clinic, so feel free to ask us for them. We're happy to supply them to our patients. And then most importantly, if you're having just your average tools, which is your regular toothbrush, cup of water, an extra cup there, it just makes it, having everything ready there just makes it really easy. Twice a day, once in the morning, once at night before bedtime, and that's our system. Thank you so much, Bill.